Today's session is about adverse drug reactions and pharmacovigilance. This is an important question for your theory examination. This is an exercise for your practical examination, and as a practitioner you would be required to report many adverse drug reactions. So, pay attention to this session. So, we will see what are the learning objectives of this session. At the end of the session, you should be able to understand what is an adverse drug reaction, what are the types of adverse drug reactions, what is pharmacovigilance, and how to report an adverse drug reaction. So, before we go into the topic proper, we will see the historical perspective. In the late 1950s, a drug named thalidomide was introduced into the market. It was introduced as a wonder drug for treating the nausea and vomiting which is associated with pregnancy. And many pregnant women were prescribed this thalidomide for nausea and vomiting, and this eventually led to the thalidomide catastrophe. The babies born of the women who were prescribed thalidomide had deformities in their limbs. They had very short limbs and the limbs looked like that of a seal's. So, this deformity was called as phocomelia, which means seal like limbs. And this led to a very big public outcry and adverse drug reaction monitoring started. When you are prescribing a medicine to a patient, you would be expecting a response from that medication. This is known as the therapeutic effect. But there might be effects that you are not expecting. So, these are the undesirable effects that occur with the prescription of this medication, and these undesirable effects, they are known as adverse drug reactions. Some of these effects, they are quite harmless, they are known as side effects. They are abbreviated as SE, and some of these effects, they are harmful. These are known as the toxic effects of drugs. So, we will be discussing about the toxic effect of drugs. The toxic effect of drugs can be classified as pharmacological toxic effects, pathological toxic effects, genotoxic effects, allergic reactions, idiosyncratic reactions, pharmacogenetic variations, and teratogenic effects. So, we will see each of this in detail. First, we will see what is pharmacological toxicity. So, pharmacological toxicity is due to the increased response to a drug. So, for example, a drug named nifedipine, it is a calcium channel blocker. It blocks the calcium channels in the blood vessels, and when the blood vessels does not receive calcium, it does not contract, and that will result in vasodilation. So, in some individuals, this nifedipine will cause excessive blockade of this calcium channels, and that can result in excessive vasodilation, and that can result in hypotension. So, this is a pharmacological toxicity, and you can predict the toxic effect produced by nifedipine, that since it is an agent that reduces blood pressure, it can produce hypotension. So, now we will see what is pathological toxicity. Paracetamol is an NSAID. It is used for relieving fever and pain. Normally, paracetamol is metabolized by the liver. And 5% of paracetamol forms a toxic metabolite called as NAPQI, which is N-acetyl parabenzoquinone imine. This is a toxic metabolite of paracetamol, and it is formed in every individual, but only in small amounts. So, normally this NAPQI will be conjugated with glutathione, and this will be eliminated. But in some conditions like in paracetamol overdose, or in alcoholics, the glutathione levels will not be sufficient enough to remove the NAPQI. So, this will result in liver damage, and this is an example of pathological toxicity. The third type of toxicity is called as genotoxicity, that is drugs producing damage to the genetic material. So, this is usually done by anti-cancer drugs. And the fourth type of adverse drug reaction would be allergic reactions, and these reactions, they are mediated by cells of immune system. Allergic reactions are reactions that occur to a drug to which the person is previously exposed to. These allergic reactions would be discussed in detail in pathology, and I will be discussing about the different types of hypersensitivity reactions and which are the drugs that produce these hypersensitivity reactions. Allergic reactions are basically classified into type 1, type 2, type 3 and type 4. We will see each type of hypersensitivity reaction. First, we will see what is type 1 hypersensitivity reaction. Type 1 hypersensitivity reaction is also known as immediate hypersensitivity reaction, and it is mediated by the antibody IgE. A person who is previously sensitized to an allergen will be having IgE antibodies against this allergen. These IgE antibodies will be present in the surface of mast cells. So, when he is exposed to the allergen a second time, this will result in binding of this allergen to the IgE antibody, and that will result in degranulation of mast cells and release of inflammatory mediators. So, this will produce the hypersensitivity reaction. This is usually seen in the gastrointestinal tract, where the person develops allergic response to various types of food like seafood. It can also be seen in the skin as urticaria. It can manifest in the respiratory system as bronchoconstriction. It can also manifest as running nose. In the blood vessels, it can produce vasodilation and can lead to shock. So, this type 1 hypersensitivity reaction is usually seen with penicillins. Now, we will see what are types 2 hypersensitivity. Now, we will see what are type 2 hypersensitivity reaction. These reactions, they are also called as cytolytic reactions, where there is lysis of cells, and this type of reaction usually affects the cells of circulatory system. It is mediated by two antibodies, IgG antibodies and IgM antibodies, and also complement pathway is also involved in this type of hypersensitivity reaction. So, example of type 2 hypersensitivity reaction is penicillin induced hemolytic anemia. Now, we will see what are type 3 hypersensitivity reaction. These reactions are also called as Arthus reactions, and they are mediated predominantly by IgG and complement cascade. So, this IgG will activate complement system, and this complement will get deposited in the vascular endothelium. And the deposition of this complement in the vascular endothelium will trigger an immune response, which will lead to serum sickness. This can manifest as skin eruptions, arthralgia, lymphadenopathy, and fever. Type 3 hypersensitivity reaction is also produced by penicillins. Now coming to the last type of hypersensitivity reaction, type 4 hypersensitivity reaction or delayed hypersensitivity reaction. So, delayed hypersensitivity reaction is due to sensitized macrophages and T lymphocytes. These macrophages and T lymphocytes will trigger an inflammatory response, which will result in type 4 hypersensitivity reaction. Example of an agent that produces type 4 hypersensitivity reaction is lamotrigine. It is an anti-epileptic drug. It can produce hypersensitivity reaction type 4. Now coming to the next type of adverse drug reaction, which is known as idiosyncratic reaction. These idiosyncratic reactions include excessive sensitivity to a drug, or reduced sensitivity to a drug. The next type of adverse drug reaction is pharmacogenetic variations produced in drug response. The proteins in our body are produced from DNA, and DNA is different in different individuals. So, all the transporters, all the metabolizing enzymes, they are a product of DNA, and since the DNA is different in different individuals, these products will also be different. So, the response of drugs can also differ, and an adverse drug reaction that occurs due to variations in genetic composition is called as a pharmacogenetic variation in drug response. Example is the adverse drug reaction associated with a drug called as primaquine. Primaquine is a drug which is used for the treatment of malaria, and primaquine, if it is used in patients who are deficient of the enzyme G6PD, it will result in hemolysis. It does not occur in all individuals, it only occurs in individuals who are deficient with G6PD. The next type of adverse drug reaction is teratogenicity. So, while we are using drugs in pregnancy, we should be very cautious because drugs can cross the placental barrier. If drugs are consumed in the initial 17 days of conception, this period includes fertilization and also implantation. So, if teratogenic drugs are administered during this time, this can result in miscarriage. And this might go unnoticed. The most vulnerable period in pregnancy is between 18 and 55 days. This is very important, 18 to 55 days. This is the time period in which various organs are derived. This is known as organogenesis. The use of teratogenic drugs in this period can result in congenital anomalies. And this is the most vulnerable period. In pregnancy. 18 to 55 days. If teratogenic drugs are administered after 56 days, it can result in developmental abnormalities, or it can result in functional disorders. So, whatever be the drug, it should be used very cautiously in pregnant women. So, depending upon the teratogenic risk in pregnancy, drugs are classified into 5 classes. That is A, B, C, D and X. Category A is the safest to be used in pregnancy. It is, example is levothyroxine, which is a thyroid hormone and can be used very safely in pregnancy. And the most dangerous category is category X, should not be used under any circumstances. Example of such a drug is thalidomide. Now, we will see what are category B, C and D. Category B means that they are comparatively safer to be used in pregnancy, and animal studies does not demonstrate any risk to the fetus, but human studies are not available. There are no human studies. This is one scenario which a drug comes under category B. Another scenario is animal studies have demonstrated there is risk to the fetus, but human studies does not show any risk at all. Animal studies show risk, no risk in human studies. This is the second criteria for a drug to be categorized as category B in pregnancy. Example of such a drug is amoxicillin. Now, we will see what is category C. Animal studies have shown that there is risk to the fetus, but there are no human studies. Or there is lack of data on animal studies and also human studies. Such a drug will come under category C. Example of such a drug is fluconazole. Now, coming to category D. Category D drugs have demonstrated risk to the fetus, but the benefits of using the drug in pregnancy will outweigh the risk of using the drug. Example of such a drug is phenytoin. Phenytoin is an anti-epileptic drug. So, this drug is used for controlling seizures, and if the woman becomes pregnant after taking this phenytoin, phenytoin can produce some adverse drug reaction. But if we are not using phenytoin, she might develop seizure and both her life and the kid's life would be in danger. So, the benefits of using the drug will outweigh the risk produced by the drug. Phenytoin produces an adverse drug reaction called as fetal hydantoin syndrome. And all the components of this fetal hydantoin syndrome can be corrected surgically. So, the benefits of using the drug would be saving both the lives of the mother and the baby, and the risk can be corrected surgically. So, the use of this drug is warranted in these conditions. Adverse drug reactions can also be categorized depending upon the time of onset of the adverse drug reaction. They are classified into acute, subacute and latent. Acute means the adverse drug reaction occur within 60 minutes of administration of drug. Subacute means 60 minutes to 24 hours. And latent usually occurs after 2 days. And depending upon the severity of adverse drug reaction, adverse drug reactions can be classified as minor, moderate, severe and lethal. Minor adverse drug reaction means that the patient does not require any treatment, any antidote, and there was no prolongation of hospitalization. Moderate adverse drug reaction means that the person required change in therapy, he required treatment, or there was prolongation of hospitalization at least by 1 day. Severe adverse drug reaction, they are life threatening, they produced permanent damage, and requires intensive treatment. And lethal adverse drug reaction means that the drug directly or indirectly contributed to the death of the patient. So, now we will see what is pharmacovigilance. Pharmacos means something pertaining to drugs and vigilare means to watch. So, pharmacovigilance is the science and activities that pertains to detection, assessment, understanding and prevention of adverse drug reaction. So, pharmacovigilance is a science and activities that are related to detecting, assessing, understanding and preventing adverse drug reaction. Pharmacovigilance is a science and activities related to detecting, assessing, understanding and preventing adverse drug reactions. We will see some terms used in pharmacovigilance. One is adverse event. Adverse events are untoward events that occur during treatment. It might not be related to the drug or it might not be related to the treatment. Any untoward event that occurs during treatment is called as an adverse event. The next term would be a serious adverse event. Any adverse event that is life threatening or which results in death, disability, congenital abnormalities, hospitalization or prolongation of hospitalization, or those which require intervention to prevent permanent disability is called as a serious adverse event. To find out whether the drug is the causative agent for an adverse drug reaction, we have got scales to measure whether this drug is the one that is producing the adverse drug reaction. Such an assessment is called as a causality assessment, which means that whether the drug is, we are assessing whether the drug is producing the adverse drug reaction. So, we have a criteria called as Bradford Hill criteria for assessing this causality. In Bradford Hill criteria, we look for temporal relationship. Which means there is time bound relationship. Basically, what we are looking is whether the adverse drug reaction happened after consuming the drug or the adverse drug reaction was there even before consuming the drug. The second thing we look for in this Bradford Hill criteria is it possible, whether there is any theory behind this adverse drug reaction. And the third thing we will look for is whether there is any dose response, that is while you are increasing the dose whether the adverse drug reaction increases, or while you are decreasing the dose whether the adverse drug reaction reduced. And the fourth thing we will look for is consistency, whether the adverse drug reaction is produced on repeated administration of the drug. For causality assessment, we have got two scales. One is called as a WHO-UMC scale and also Naranjo algorithm. These two scales are commonly used to assess the causality. So, now we will see what is Pharmacovigilance Program of India. It is abbreviated as PvPI, V with a small letter. It is Pharmacovigilance Program of India. The goals of Pharmacovigilance Program are to ensure that drug use is associated with more benefits than risks, and also to safeguard the health of Indian population. The objective of Pharmacovigilance Program is to monitor adverse drug reaction, to create awareness among healthcare professionals, and to understand the risk benefit profile of pharmaceuticals and to create recommendations based on this profile. To understand the risk benefit profile of pharmaceuticals and create recommendations on their safety according to these data. Who can report an adverse drug reaction? Healthcare professionals can report adverse drug reactions, and consumers can also report adverse drug reaction. Now, ADR PvPI app is available in Google Play Store, where you can download this application and you can upload adverse drug reaction. And usually adverse drug reaction forms are obtained from CDSCO website. If you type in suspected adverse drug reactions, you will get this form from CDSCO, and the form looks like this. So, this is a very important practical examination point. This is a exercise for you in the practical examination. This ADR, suspected ADR reporting form, has got many parts and you have to know what all to write. The first part is patient information, where you have to write in the patient initials. You do not have to write the name of the patient, you just have to write the initials. This is to maintain the confidentiality of the patient, age or date of birth, gender and also weight. The second part is suspected adverse drug reaction, the date at which the reaction started, date the patient started recovering, and description of the adverse drug reaction. The third part is about the suspected medications. So, you have to write down all the suspected medications, generic name or brand name, manufacturer if it is given, batch number or lot number, the expiry date of the medication, the dose, route, frequency, and when the drug was started and when the drug was stopped, what was the indication, and the causality assessment. These are the things that has to be written for each suspected medication. So, if you are suspecting more than one medication, you have to write all these of each medication. And the second part is what action was taken after this adverse drug reaction. Usually, we will be withdrawing the drug or reducing the dose of the drug. This would be the two things that would be usually done. So, if drug A is in column 1, if that drug is withdrawn, you have to tick here, and if drug B is in column 2 and the dose was reduced, you have to tick here. Okay. And the next part is reaction reappeared after reintroduction. This is known as re-challenge. This is not usually done if the adverse drug reaction is lethal or serious. So, if by any chance the patient stopped the medication and he started the medication again, so you have to check whether the adverse drug reaction started after reintroduction of the drug. And also the concomitant medical products, that is over the counter medications, dietary supplements, all that has to be written here. and their dose used, route, frequency, date started, date stopped, and the indication for it was used. And the relevant laboratory history, medical history has to be written, and the seriousness of the adverse drug reaction, whether it was life threatening, whether it required hospitalization or prolongation of hospitalization, whether it resulted in death, congenital anomaly, whether intervention was required to prevent damage, or whether there was any disability. And the outcomes of the adverse drug reaction, usually the patient will be recovering. So, you will have to write whether the patient is recovering or whether the patient has not recovered or has he completely recovered. So, after you have completed this form, you have to give it to the nearest ADR monitoring center or AMC, and this will be sent to the National Pharmacopoeia Commission office at Ghaziabad, New Delhi. So, to summarize, an adverse drug reaction is any unintended effect that occurs with the treatment, and there are many different types of adverse drug reaction, and the monitoring of adverse drug reactions is called as pharmacovigilance. And to report adverse drug reaction, there is a application ADR PvPI, or you can download the forms from CDSCO website, and you have to fill in the details and send to the nearest ADR monitoring center. From there it will be sent to Ghaziabad. So, remember, this session is very important. Pharmacovigilance is a question that is asked in theory examination, and this ADR reporting using the CDSCO form is a exercise for the practical examination. So, remember all these details while you are doing the examination. Thank you.